The impact of losing your sense of smell is often underestimated by the medical community, despite the major impact it has on patients' lives. Many patients who lose their sense of smell also lose their sense of taste. This is incredibly debilitating for them, robbing people of 2 of their 5 senses, which are crucial for well-being. Well, to help patients understand smell loss, Sanofi has launched an exciting new initiative. It's the production of a smell booklet, giving patients all the facts they need to understand smell loss in the context of having nasal polyp syndrome, or CRSwNP. This is EUFOREA News broadcasting from the United Kingdom. Hello and welcome to EUFOREA News. I'm Dr. David Bull. CRSwNP, or chronic rhinosinusitis with nasal polyps, is a chronic disease of the nasal mucosa and paranasal sinuses. It's predominantly mediated by type 2 inflammation and affects about 1 to 2% of the European population. Many patients with CRSwNP also have comorbid asthma, but one of the most distressing symptoms reported by nearly 3/4 of patients is losing their sense of smell. This has a profound impact on their quality of life. And yet, the significance of this is often downplayed by clinicians. The question we have to ask ourselves is, why? Well, joining us now is Professor Peter Hellings. He's the founder and chairman of EUFOREA. He's also professor in otorhinolaryngology at the Catholic University of Leuven in Belgium. He's also clinic head in the Department of Otorhinolaryngology at the University Hospitals of Leuven. Peter, always good to talk to you. Now, losing your sense of smell is so profound, and yet often the impact of that is underappreciated by physicians. Why is this, do you think?
Well, first of all, thanks for having me again, David. And this topic of smell loss is indeed very important, as smell loss is still under-recognized as a severe problem, both by the medical community as well as by the patient community. And there are several reasons for that. But if I focus mainly on the reasons why physicians do not always feel comfortable when they are confronted with the patient having smell loss, this could be due to the fact that the diagnostic procedures are a bit complicated on the one hand, and the therapeutic options are also limited on the other hand. So therefore, and the combination of these reasons give actually rise to the kind of under-recognition of the problem of smell loss in patients.
And yet the testimonials from the patients are pretty significant. They say things like, well, my life isn't very enjoyable. I can't taste food. It's like watching television, but only watching in black and white.
Indeed, David, in a tertiary care rhinology center, we see those who suffer from smell loss for a long period. And those patients are often very frustrated, not only because the loss of smell itself, because this is causing a major impairment of the quality of life, but also because of most patients with smell loss also experience part of losing their taste. So smell loss and taste loss go hand in hand in the majority of patients with significant smell loss. And patients are often lost because when they are confronted with smell loss, they are not always referred to those physicians that take smell loss seriously.
So let's have a look at the frequent causes. What are they, the causes of losing your sense of smell?
Well, from a clinical perspective, we tend to divide smell loss into 5 different causes, and every cause is actually subject to diagnostic and therapeutic options. The first cause is a viral infection. We all know, thanks to the COVID pandemic, that a viral infection may cause smell loss, and this has always been the case. There are so many viruses that can all of a sudden and very suddenly cause smell loss in a patient. Secondly, any kind of head trauma, like falling off a bike or a head trauma in a car or during walking on the street, may give rise to sudden smell loss. And this smell loss could be total or partial, but this is the traumatic smell loss that we often see in daily clinic and for which patients seek a solution. A third reason is the inflammatory smell loss, where patients with severe allergic rhinitis or with sinus disease often present with smell loss being one of the symptoms that bothers them most, in conjunction with nasal obstruction, rhinorrhea, headache, and other symptoms. So the inflammatory smell loss, as we see it mainly in those patients with CRS with nasal polyps, is a large group of patients that are part of our daily routine. But besides viruses, trauma, and inflammatory smell loss, there are also two other causes of smell loss. And one is a smell loss where we do not really can define the reason for a smell loss. So this is called idiopathic smell loss. This is smell loss where we do not know the underlying cause. And a fifth reason for smell loss is previous sinus surgery, where during the surgical procedure, there has been some reduction of the capacity of smell or a damage to the olfactory nerve, giving rise to smell loss in patients.
I was particularly interested in your first answer about viruses causing a loss of smell. Do we know what the pathophysiology is behind that? Is it damage to, say, olfactory receptors? Is it nerve damage? Is it inflammatory mediators? Is it a mix of all of the above?
I think you're very clever, David, and you also highlight the fact that there could be a mix of reasons why viral infections are associated with smell loss, and they're all linked with a direct damage and direct dysfunction of the smell organ, which is based anteriorly in the skull. Or it could also be inflammatory with swelling of the sinonasal mucosa, impairing the molecules to reach the olfactory region, or could also be linked to the systemic component of an inflammatory infection, whereby inflammatory cytokines or mediators give rise to a dysfunction of the olfactory organ. So the combination of these factors may all be linked to smell loss in patients experiencing a viral infection.
Now, I assume the first port of call tends to be the primary care physician, who probably doesn't know a great deal about smell loss. Let's say they refer to an ENT clinic. What can be done in an ENT clinic to diagnose smell loss?
The first pillar of a diagnosis is indeed a proper history taking, where we hear from the patient since when and how smell loss occurred on the one hand, and we also want to understand the degree of smell loss. Is it partial loss or total loss of the smell capacity? Because that gives us hints towards the cause of smell loss. After having taken a proper history, it's time then for a proper diagnosis, which is not only looking in the nose with a simple speculum, but preferably also performing a nasal endoscopy, where ENT colleagues can evaluate to what extent the endonasal cavity and also pathology in the sinonasal region could be defined or detected. If nasal endoscopy may not give the answer, we might also rely on a CT scan of the maxillofacial massif, where we evaluate the olfactory region, which is the region in the area of the frontal sinuses. So in the end, ENTs rely on the basic diagnostic procedures as we perform in every patient with nasal disease in order to diagnose the smell problem. But in most clinics, this diagnosis is supplemented by smell tests, and smell tests are often performed in rhinology centers where ENT surgeons with a special interest in nose and sinus disease or in smell loss do some extra efforts in order to not only diagnose smell loss, but also understand the severity of smell loss and also evaluate smell loss over time.
So let's look at some of those smell tests, particularly sniffing sticks. How do they work? Because my understanding is there are sort of different things you can do with them.
So first of all, I go one step back and I need to inform you there are several smell tests available. These smell tests are commercially available, and some of the simple ones are the sniffing sticks, whereby a nurse or a doctor offers a stick with a specific smell to a patient, and a patient is asked to make a guess out of 4 odors and informing the nurse or the doctor what kind of smell is being detected. So the sniffing sticks are composed of 16 sticks that are being offered to a patient. They're held underneath the nose, and the patient is asked what kind of odor is being smelled. And we have a scoring system. This scoring system is validated. And after a test, we can define a patient as being normosmic, having a normal smell, being hyposmic, having a reduced smell capacity, or being anosmic, which means the patient doesn't have any smell capacity left over.
Now, you said there were different tests that you could do. You mentioned sniffing sticks there. What else can physicians do?
Well, there is a large number of commercially available smell tests that are routinely being used in several centers, and I mainly refer here to the ones that are most popular, which are the sniffing sticks, the Barcelona smell test, as well as the UPSIT test. And UPSIT is the University of Pennsylvania smell identification test, which is a kind of expensive test that works very well in the US because some of the odors that are being presented to individuals may be linked to the American society and the American flavors and smells that are around and that are well recognized by the US citizens, but less applicable in Europe and elsewhere in the world. But we in our center, we rely on the sniffing sticks because these are cheap, simple to perform. They don't take more than 10 minutes to be carried out. And they're actually quite simple to perform and also simple to interpret. So that's all what we like in daily practice.
You talked very specifically there about diagnosis, taking the history, which was important, the examination, the test that you do alongside that. Now, let's move on to treatment. What is open to you in terms of how you can treat smell loss?
Well, it all depends on the underlying cause, what treatment strategy we would opt for. But it's just good to highlight that whenever there is an inflammatory condition giving rise to smell loss, that we would, of course, consider anti-inflammatory treatment first. Many of our colleagues would give oral corticosteroids or nasal steroids on a longer period, or even nowadays in those patients with CRS with nasal polyps or nasal polyp syndrome, in those patients, we rely on either biologics or sinus surgery to improve their smell capacity. When we talk about patients with a post-viral smell loss or post-traumatic smell loss, there we might also consider olfactory training, because recommending a patient to regularly smell on strong odors has been shown to improve the smell capacity and has been shown to induce a growth of the olfactory bulb in the skull in the brain of a patient. So olfactory training in those without a total loss of smell, so in those where there is still some remnant smell capacity, might be highly recommended as well in this patient population. So summarizing, anti-inflammatory treatment, sometimes, and in cases of CRS patients, we may recommend surgery or biological treatment, and also olfactory training could also be recommended.
We started this interview talking about the impact that smell loss has on patients. Now, this smell booklet, a brand new initiative, how do you think this is going to help patients and also help physicians?
Well, the smell booklet that has been developed by one of the partners of EUFOREA and that will be disseminated also with support of EUFOREA is actually very important because it gives an overview of the problem of smell loss in patients with sinus disease and how patients and physicians should better understand the mechanisms linking systemic cytokines or nasal polyp disease with smell loss, and also what can be done not only to detect smell dysfunction, but also to have a better smell capacity in patients. So this smell booklet is actually the way forward in order to better train and educate physicians on how smell dysfunction is being induced on the one hand by an inflammatory condition like CRS with nasal polyps, and also gives an overview of the potential treatment options that could be envisaged in these kind of patients with smell loss related to chronic rhinosinusitis with nasal polyps.
It's extremely well written. It's very explanatory. It brings the whole subject to life. Are you hopeful that this will actually push the message that physicians will feel empowered and educated?
Well, if we would not believe that this would improve care, we wouldn't support this initiative with the full EUFOREA team. So we believe that having this smell booklet, helping physicians and patients to understand better what smell loss in relation to CRSwNP is all about, will help patients to be more aware of this problem and also help patients and physicians to understand better how the novel treatment options may help them in achieving better outcomes of care, including better smell capacity. So we do believe that this booklet will help to improve care for patients, and therefore we are in full support of this initiative.
Peter, it's always a great pleasure to talk to you. Thank you very much indeed for your time. That's Professor Peter Hellings.
Thank you, David.
Well, that's it for this EUFOREA news. A brilliant new resource there from Sanofi. It's called the Smell Booklet. And thank you once again to Professor Peter Hellings. Now, as I mentioned earlier, Peter is the founder and chair of EUFOREA, and you can find more information about EUFOREA and register for the EUFOREA educational events on the euphorea.eu website, where you can also sign up to receive the latest news via email. You can also follow EUFOREA on social media, on YouTube, X, LinkedIn, Spotify, Instagram, and Facebook. Thank you for watching. Until next time, bye-bye.